Childbirth remains one of the most significant moments in a woman's life, and over 140 million babies are born globally annually, but most of these are born through natural methods, or what we would call vaginal delivery. However, there are others that are also born through other methods that are artificially induced because the mother is not able. But today we are going to focus on normal delivery / vaginal delivery. And you're welcome to NTV Medical Matters. I am Viola Sasira, and as always, we have our expert in studio, and we shall be talking about this today. Once again, we are supported by Bill and Melinda Gates Foundation. A very good morning to you, and you are welcome. Welcome back, and thank you so much for being a part of us this morning. I am Viola Sasira, and NTV Medical Matters is supported by Bill and Melinda Gates Foundation. On this episode, we talk about normal delivery or vaginal delivery. So we have our doctor in studio who's going to take us through this very critical discussion, because giving birth is indeed something very, very hard for some mothers. So more information is needed to be able to stay safe while you go through the same. So we have Dr. Rosin Ainembabazi, who is going to help us understand more about normal delivery. Doctor, you're welcome. We shall start off with vaginal delivery, or what others call normal delivery. I'm not sure whether it's normal or not, or whether it's the only normal one, but what is it exactly for somebody hearing this for the first time?
Oh, okay. Thank you so much, Viola. So vaginal delivery or normal delivery is delivery of a baby through a birth canal. Like a woman has carried a baby up to term, and the baby has to come out. Yeah. So there's a normal birth canal, which is the pelvic. You have a uterus up, then the pelvic girdle, which is your hip bone. Then through that hip bone, the upper part is the inlet, the inner is the body, then out is the outlet. So through that out, then it goes to the vagina. So that is the normal birth canal. So that is when a baby comes out through that route, it's normal delivery. However, there are other ways baby can come out. In case the baby is unable to come out through that canal, we have to, by emergence, sometimes we support them pass through the canal, and sometimes we have to cut the abdomen to deliver the baby in case they can't fit through the canal.
So sometimes when a baby is too big to fit into the canal, when you push the baby through or try to aid the mother to have the baby that way, won't that actually affect the baby's, I believe, brain?
So what happens with the baby, like before we actually allow you to push, we do an assessment. That time, long ago it used to be at 37 weeks, every mother was checked. But now we wait for you to have labor because a bit it's uncomfortable. Yeah. So when labor starts, I'll tell you the signs of labor. You come in, we assess. So in assessing to allow you to push, the whole process is passenger, passage, power, and boo, you're out. So the power is the force of contraction of the uterus. It gives it a push power. Then the passenger is the baby. Yeah. Then the passage is that canal. So we assess and see, is the baby too big to pass through the canal? Is the canal too small to allow the baby to pass through? That is the passage. Yes. So there are different things we shall assess and give you a go-ahead to vaginal delivery.
What are some of the signs that labor has started that mothers watching should look out for, or even just anybody trying to have a child? What are some of the signs? Okay.
So some of the signs that happen, we take labor as a natural occurrence. If you've seen a hen going to hatch, we can put it to the natural. If a hen is going to hatch, it will have to prepare its place, it makes a nest. So that same thing happens to people, like naturally. You're usually in third trimester, towards the end you're tired, sometimes you're eating less. But before labor, there are some changes that will happen to you. You'll find yourself eating too much, like to gain energy. A pregnant mother, a mother in labor can take a whole 2 days in labor without eating. So right before the labor starts, you've eaten too much. You've cleaned your nets, like your bedroom net is dirty. So you clean around your bed where you receive your baby from. You clean the shower. So all those are changes that will happen in labor. And also, there's a way you have a lot of energy, then later the energy drops. Then you know that within a few, you feel some pains. So those are the natural hints that labor is starting. However, there are signs you'll see that labor has really started. What are those signs? You'll get pains. Labor comes with pain. This pain should be differentiated from the false labor. There's false labor and true labor. So when the pain has started, the true labor pain, they are on and off and regular, and nothing ever stops them. If they've started, they will continue and continue and continue. Then the other thing, you see that labor has started. If it's false labor, the pains are continuous. They are continuous. Labor pain, true labor pains are not controlled by a painkiller. False labor is controlled by a Panadol. Then true labor pain, false labor is when you change posture, sleep a bit, it goes, the pain goes. But true labor, it's on and off, keeps increasing in intensity and also duration. Yes. So the other thing you feel as a sign of labor is your cervix has opened. You've seen mothers, I always joke with my mothers that ever since you got pregnant, have you seen your periods? They said no. So when labor starts, you see blood. You can see blood on your knicker. You've been very fine. You've not seen your period.
Is that normal?
Yes. No, it's normal. So when you see the blood, you're like, boom. You should be excited that labor has started. You shouldn't get anxious. But you come to the hospital. All those are signs to come to the hospital. Then the other sign you'll see is water breaking. Some of my mothers have been sleeping. Then you wake up and the whole bed is wet. So when you find your whole bed wet, please, you come to the hospital. Usually some can step back. They think that they've urinated on themselves. But when you think back, you've not urinated. Whenever you urinate, even if it's at night, your brain signals that, hey, you've urinated. Or whenever you're walking and the water breaks, the baby's water breaks, you should always know that this is the baby's water. If you've delivered before, that water has a unique smell. I always tell my mothers, the pad you used in your previous pregnancy, it's the same as this water. It smells like that. So the smell is different from urine. Then you've not felt the urge that you've urinated.
Okay.
So whenever you see those, run to the hospital.
I'm beginning to think that when I finally have a child, I might actually camp at the hospital like a week before, because I feel like at times it will just sneak up on you. How will you know? Some of those signs seem to be short notice.
So what happens? Actually, the whole labor thing is it's associated with a lot of anxiety. When you conceive like this, mothers are so expectant. You're happy, vomiting comes in, then you start to shop. So you're anticipating your baby. You're wondering, how does my baby look like? You do a scan and you're like, oh, but how is the nose? so when labor hits in, it's supposed to be a relief. I always tell mothers, don't be so scared about it. Be excited that, oh, finally, all that anxiety I had is coming to end. I'm going to see the real baby.
I bet some of them share worries with me. My worry would be, what if the baby sleeps or drops before I get to the hospital? Or what if, we've seen cases of people give birth in a car, or on a border or something like that. So I think just the timing scares some people.
So about people who always deliver in the car, there are people who don't get labor pains. They don't experience pain. Usually when your periods are not painful, I've seen such mothers not have pain during their labor. So you should see these other signs. Baby doesn't just fall. At least you'll see some wetness, you'll see some water break, you'll see some little blood. But the mothers who always deliver in the car, they neglect those signs. Yes. So when you see those signs, come to the hospital. However, in preparation, when we are preparing mothers, the last visit is about labor, how to conduct delivery, how to how to notice that labor has started. So in that, we always need a couple to come, the husband and wife. Yeah, I trained the husband on how to conduct a delivery. Or these days we encourage mothers to look for someone they will labor with. Yeah. So earlier in time, we prepare you. If it's your sister, alert her that my EDD is nearby, so be alert. In case she comes in your house, we also train her on how to conduct a delivery.
Expected date of delivery.
Of delivery, yes, the expected date of delivery. So when your sister comes in, we train her, or your husband, we train them on how to conduct a delivery. You've seen goats deliver. It has not been an emergency. And some of us, our mothers, delivered us in the banana plantation or at home. So it can be a natural process. So we teach you, if the baby has come, you've seen the baby out, don't push the baby back in. Clamp the cord. We encourage you to have a mama kit in the house. Move with it everywhere you go. If it's in the taxi, someone will put your cavera, will get your gloves, will clamp the baby. But the anxiety comes in when you're not prepared. You're not moving with your mama kit and a lasso. So you clamp, you clamp, then you separate the baby from the mother and get the baby wrapped and proceed with the mother to hospital. Then we finish delivery.
You know, you make it sound so easy. You really make it sound so easy. I don't know, maybe because you've done it for a while. Okay, so some mothers spend about 8 to 18 hours in labor. What's actually happening, and why is it so intense for some of them and not the others? Okay,
so the first timers, we call them prime, meaning first time. First-time mothers, they always have, they take longer because their prostate is not sensitized, the receptors are not sensitized, then also their muscles are a bit tight. Yes, so they take longer in labor. But what is the ideal time? How long should I take in labor? That can take us to stages of labor. Labor is not a whole length of a period, but it's divided into phases. We can go through the stages. So the stages of labor, there are 4 stages of labor. The first one is divided into 2. We have the latent phase and the active phase. Then we have the second stage of labor, which is the delivery of the baby, awaiting the placenta to come out. Then we have the third stage, where you expel the placenta. Then we have from the delivery of the baby to the placenta coming out. Then we have the 4th stage, where you're monitored for around 6 hours. And that is also part of labor.
A quick question. What happens, how does the placenta come out? Is it forced? Is it aided? Is it just aided. Natural? What happens there? Okay, fine.
So for the, if we go through, for the placenta to come out, okay, when we talk about the stages of labor, the first stage, I told you it's latent stage. Latent means you're beginning, like the baby wants to come out, but has not really, the process of pushing has not really started. The contractions are not strong enough to push out the baby. So this labor usually can be at your home. You feel crampy, it's not yet intense, it's actually not noticeable. Usually some mothers can tell you, I've been with this for 2 weeks. So it can go on as long as 2 weeks. But it's good when you feel, you keep going to the hospital, they check for you and allow you to go home so that you can progress normally. Then the other thing, the active phase, is when the head has fully engaged, has dilated the cervix, and is trying to come out. So for second stage, it's for latent phase, the centimeters. You've heard of centimeters. Yeah. So labor is termed in centimeters. For the latent, it's 0 to 4 centimeters. So for the active, someone is dilated to 4 centimeters up to when the baby comes out. So when you're fully dilated, you're in second stage. Like the cervix is fully open, the head is fully down, and the baby is going to come out of the vagina. So that is second stage. When baby comes out, the next thing that stays behind is the placenta, which you've asked me. So now the placenta is the food for the baby. We never encourage that placenta to come out before baby. It's an emergency. because it's the one feeding the baby. So that's why even in birth, like for some people in the developed countries, they allow you to sit in your bathtub as baby comes out. They are not worried that the baby will fail to breathe because the placenta is still attached onto the cord. So when you've delivered your baby, the placenta has to come out. So placenta coming out, when baby comes out like this, they give you an injection. That injection is to stop bleeding. It helps your uterus to contract. So that vigorous contraction shears off. Like imagine the placenta was attached on a big surface area, and now the uterus has shrunk. So it itself helps the placenta to detach. Then when it has detached, there's something we call controlled contraction. You pull gently down and upwards. Down, but there's no need to panic. So within 30 minutes after baby has come out, the placenta, we give it that whole time, 30 minutes for it to come out. If it has not come out at that time, we term that as retained placenta. If it has come out at that time, there's a way you can see signs of the placenta detaching. You see a gush of blood, you see the cord elongating, you'll also feel, the mother feels the urge to push. So that's when we tell them, push, another baby is coming out.
Yeah, I've heard about that.
Another baby too is coming. So they push and that placenta detaches. So that's how we gently remove the placenta. However, if it stays after 30 minutes, it's a medical emergency. Mother is transferred to theater and you're given anesthesia or pain management because it's painful to remove that placenta. We connect blood, then we gently shear it off. Follow the cord and shear it off.
I'll not even try to dive too much deeper into there. But our callers may find that very interesting, and this could be a point where they will call in. So callers, make sure you have your questions on standby because this is getting very interesting. Yeah, so what causes labor pains? What exactly is happening? Is it hormones, something like that? So I need it in that angle to understand.
So normal labor should start after 37 weeks. Some people start labor before 37 weeks. We call that preterm labor. Like you're at 32 weeks and you see water. All the signs I've told you. So that is dangerous for you. Baby has to come out. Sometimes we can actually have bleeding or the water gushing out, but it's little. So you come to me again and I will assess, do a scan, how much water is left. We see how to prolong. But you have continuous leakage of membranes, like water is leaking. We have to mature the baby's lungs and make aid the baby to come out before time. So true labor or normal labor, as we have called, it should be the right way. It should be after 37 weeks to 41 weeks. So all that is a normal timing for the baby to come out. So what makes the baby come out? I always joke with my patients and tell them, like, you see how there's a balloon and you're pouring water in that balloon or air. At some point, the balloon for it will burst. But what happens with the uterus, it's an elastic thing. Imagine like you're pulling on a rubber band. So the more you stretch it, the more it also mounts, it recoils back. So that recoil back is the mechanism of pain, of contractions. So in case the baby grows and is grown enough to stretch the uterus to the capacity, it also starts to coil back. And that's why we have false labor and true labor. For false labor, the coil back, maybe the baby is not yet fully mature, the coil back is less. For true labor, the coil back is enough, yes. So that's a baby's weight, a baby's size, how the baby stretches the uterus can trigger the labor to start. Then the other thing, we have the baby's engagement onto the cervix. The baby, when they are coming out, they go into your pelvic girdle and they put their head. So they start to push. Every time there's like a contraction, they push onto the cervix. So in that, we have babies who will never bring labor, like anencephalic babies, babies without brain. Some babies don't have a head to go onto your cervix and dilate it. So even if you stimulate labor, labor never starts. Then we have times when the cord is very short So when the cord is very short, the baby will not reach down to increase the labor. So even if you will go carry your baby, reach 42 weeks, then
ask you about the pregnancies
reach 42
that
weeks,
longer
and the labor will not start because the baby cannot go down to trigger the receptors of the cervix. Cervix is the mnwagwa n'abaana. So when it reaches there, it triggers, then the whole labor starts. Yes. So there are also hormones called, we have oxytocin, which aids in labor. It's a natural hormone. However, we also inject it in mothers to induce labor or to help the uterus contract. So some, when you trigger the cervix, it pulls out like inflammatory markers, prostaglandins, and we also have those prostaglandins that are artificially made also to cause labor, like misoprostol, dinoprostone. They help to trigger the uterus to contract, hence stimulating the oxytocin receptors.
I'm thinking about it. I've read about them somewhere that they're responsible for period pain.
Period pain, yeah.
And they come from what food?
The food, we have pineapples, can have some. We have grapes.
So those will help you to have
labor start, to help you with labor start. So now when you have that, you will have the whole process of contraction, releasing on and off, and the baby will come down. Yes.
I'm just mind blown. I just keep on getting lost because I'm just thinking and I'm picturing everything, What are some of the methods that are safe to enable a mother have contractions if they have failed? Not because the cord is short or something is going on, but they just do not have contractions. What are safe methods to induce contractions? So
safe methods to induce contraction. By the way, there are families that have no receptors. You find like the mother didn't get labor, the daughters all don't have. So even if you use different methods, they will sometimes fail. So such mothers, you've seen them, all of them are going through Caesar. They go to hospital, they try to induce, and things are failing. So how do we induce labor? Back to the question. So induction of labor is like tampering with a natural method. It's a risk. If a mother has been not high risk and we induce labor, in my mind as a gyne, I know that I have a high risk mother in my labor suit. So high risk, what does high risk mean? When you've induced, what methods do you use? You remember I told you about prostaglandins.
Yes.
So the best method of induction is dinoprostol gel. We use a gel, we put it in your vagina. It helps to stimulate the inflammatory markers. And this will help to trigger the labor to start. There's a way we do it and monitor. I won't go in that detail. However, an alternative is misoprostol. This tablet people used to abort.
Oh, I've heard about it.
So long ago, people used to use very high doses, but now we don't encourage. Like you find midwives up country, they get a tablet, they put it in a mother's vagina. In a short time, the mother is bleeding and dies.
Oh, goodness. So
the way we've improved our induction, we don't give very high doses. Just one tablet, you drink it in 8 doses. And the doses are at an interval of 2 hours apart. One tablet can go the whole day and you're inducing with it. So that helps the labor to start. Then the other way you can help labor, before we induce labor, we first do something called a Bishop's score. Like how likely is this mother going to go in labor if I induce? And that is a medical thing. Your gyne will assess you, will say, no, let's first do this before we really put on contractions. So Bishop's score, they keep assessing your pelvis. They assess how effective the induction method is. And yes, you will deliver. But in case things fail, remember induction is a high risk, both for the mother and the baby. For the baby, in that every time you're contracting, your baby is lacking oxygen.
Yeah.
So you can easily get birth asphyxia, like you get a tired baby, and that can be a permanent brain damage for the baby. So it's all risky. So in case you've gone to the hospital, you've first of all gone past the dates, then the doctor decides on inducing you, just know you already have many factors. In case the doctor tells you you're not able to make it, many mothers first resist, and that delays in decision making, because I can't operate someone who has not allowed. Yes, later they will allow, but sometimes they allow when it's late and the baby has already died.
Okay, so how long does it take for a baby to get out through the birth canal? How many hours?
So we can talk about the prime gravida, like someone who's the first time to deliver, then someone who has delivered over time. So when you're it's first time for you to deliver, the latent phase is around 6 to 8 hours.
Okay.
It can even go to 12 hours. But if you've delivered before and the latent phase, that's the first stage of labor, the first half of first stage of labor, it should not go beyond 8 hours. It should not go beyond 8 hours. Then when the labor is active, we expect you to dilate 2 for every centimeter. Like when it's your first time, you take 2 hours. When you've ever delivered, you take 1 hour. So if they tell you you're 6 centimeters, within 1 hour, we'd expect you to be 8 if you've ever delivered. So it's longer for the first timers.
I have a question about food before delivery or drinks. Are mothers allowed to drink or eat before delivery?
So currently, long ago, even as we used to fear delivery because people would tell you how midwives abuse you, but we've totally changed the delivery to patient-centered. It's no longer a midwife comes and checks you, open your legs. Why? No, we are so gentle. It's about a mother who is going through stress and is bringing a baby out of their body. So if you're getting into labor, I want you to be very, very comfortable. So in the first plan we do, we encourage you to drink and eat at the right time, even more regular. If you feel like food, they should give you the food you want because your body is going through stress to deliver that baby. Then the other thing that happens is pain management. Long ago they would say guma, guma, guma. But now we have very many modes of pain management. Actually just normal paracetamol, Panadol, reduces the threshold of pain from 100% to 60%. So you are a bit more comfortable when they give you that Panadol. We have other painkillers like Tramadol. It helps with pain management. Then we have epidural. Mothers who consent for epidural, it's very nice. You push your baby, you'll be repaired without feeling any injection. You go through that whole labor time without pain. Yes, and it's happening around Kampala. In most
I have
hospitals.
another question now that you bring that up. How safe is that when the mother is not feeling pain, which I am imagining it helps in making her give birth. So when she's not feeling pain or has a stillborn, how does that work?
So pain is not the same as contractions. So what the epidural does, it removes the pain, but the contractions keep going on, and we keep monitoring you.
That's so wise.
So some women have made up. You see someone has a red lipstick.
I see
she's
the
in labor,
pictures,
she's smiling, she's laying, and the baby comes out.
Yeah.
So the other thing about labor management that has changed over time is we ask you to have a companion with you.
We can speak more about the companion. That was the point I wanted to bring up, but also about stillborns, the babies who are, in that state. How does that work between the mother and the baby? So let's have a commercial break. NTV Medical Matters will return shortly, and we are discussing normal delivery, or what you would call vaginal delivery. Stay with us. That break, and thanks for staying with us here on NTV Medical Matters. We are supported by Bill and Melinda Gates Foundation. I am Viola Sasira, and in studio with me this morning is Dr. Rosin Ayenembabazi. We are talking about normal delivery or vaginal delivery, and why is it advised by several doctors that should be the safer method. Before we broke off, Doctor, we were speaking about the presence of a family member or somebody support you, but also what happens during labor when you have a stillborn. So we can start with the stillborn.
Okay. So it's very, very, very sad for a mother to lose a baby. Even if it's 2 months, even if it's 2 weeks, you've already become anxious. You've missed your period and you're looking forward to a baby. So when we terminate that anxiety, it really comes with a lot of depression. Actually, as doctors, I think we've neglected what happens to this mother after she left my place with a stillborn. So a stillborn, when you have a stillborn, you have to let that baby come out of your... okay, stillborn means baby was born without life. Sometimes this could have happened before term, before baby came out. Like someone comes, you do a scan and there's no heartbeat. Then you deliver them, you have to deliver them. What happens when you leave that baby in her womb, it consumes it's a dead tissue. So it consumes the clotting factors, it consumes someone's blood, so they will get anemic, they will bleed easily because the platelet levels have gone down. So we need it to come out as soon as possible. And also they are not healthy tissues. So a lot of things causes them, like diabetes, like hypertension, pressure in pregnancy. But the surprising bit, you can have a mother who has pressure in pregnancy, but they don't take those things serious.
You know, putting that aside a bit, when that baby is dead, say they died a month before or something, how is the delivery in itself? Does the mother get to push because the baby is just, you know? So
usually when the baby is dead, within like a few days, it triggers its labor. When life continues, when life ceases in the womb, the womb detects that it has to push whatever is in it out.
Okay.
So in case it doesn't, we have to make sure the baby comes out. In case you have no like previous scars, no contraindication to vaginal delivery, we put drugs that will help you contract and push the baby out. But in case you have like scars, you will find us still having to operate you to remove the baby. Even if they are not alive, we have to do what you would call a Caesar. For us, we call it hysterectomy. Like we have to cut your abdomen and remove the dead baby out of you so that you have life.
Okay. What are some of the complications that doctors look out for at the time of delivery?
Delivery of the stillbirth?
No.
Normal delivery.
Our normal delivery.
Okay, fine. So what we are looking out in the process of delivery, actually, what mothers should know that your gyne is more on pressure for you to have your baby well. So we are always carrying patients' pressure. We have to make sure we monitor you, and that's why when you're in the hands of your gyne, you should be safe. You should feel like, I will just push when the baby time reaches. So your gyne will monitor your baby. First of all, as you're in the labor suit, we are taking care of two people at the same time. We are taking care of the baby, we are taking care of the mother. So we have to monitor, is the baby okay? If the baby is fine, we continue with the process of normal birth in the normal birth canal. Then if the baby's heart maybe stops beating, reduces to beat, or starts to swing, then there we have to do a C-section to save the baby. Then, so the indication of normal of delivery for the mother, like what are the things we monitor on the mother herself? So that was the baby. So for the even on the baby, we have to monitor, is the baby is being pressed by the bones. Sometimes we tell you the head is beginning to swell, which means that it's not fitting well in the birth canal and the bones are pressing on the baby's head. So if that happens, we tell you that things have failed. If it doesn't, we continue. The other thing we monitor on the baby is molding. The baby's head has some gaps and some spaces that you see breathing. People call them breathing spaces. So in case those spaces get squeezed and they are still in your womb, we tell you the baby cannot come out. If you insist, we have to explain to detail and make sure you at least understand. So when that happens, baby needs to come out by C-section. If we insist and the baby is showing us, I'm not coming out well, something is not okay with me. Like for some mothers in Kawempe who have totally insisted, you find they get babies with cerebral palsy. Oh my goodness. They are insisting, baby has no enough blood.
Why do you think that some mothers really insist on having the child
that way? Some mothers really insist because they feel like, I've pushed all my babies. So this one I also have to push. Then also some, their parents, like their mothers in labor, like your mother, okay, I'm in labor and my mother will always want you to push. It's like, these days, mothers, you're so weak. You want to be cut all the time.
So stigma.
Guma, they tell the woman to guma, yet you are seeing signs that everything is not okay. So that bad advice from family support is not good.
Yeah, because we're just speaking about family support, but then it sounds like it can also be negative.
It can be negative if the person is not educated. Then the other thing we monitor in delivery on the mother. Sometimes the mother gets, like, the uterus is trying to push the baby, but as if we have the lower uterine segment and the upper one. So the lower one is pushed too much that it starts to swell. So you see the uterus practically trying to divide. If you insist and continue, we see this uterus is rupturing and the mother is still trying to push. So if we see such danger signs, we look out for them. We don't tell you, we advise you, please, we have to do a C-section. And it's good for people to understand and allow at that time.
For some mothers who continue with the natural birth or normal delivery, how come some of them experience a lot of tears or they get cut and all that?
So what happens, one of the things that has improved in modern laboring is that we encourage you to take different postures. Like sit on a bucket.
I think we have a caller. NTV Medical Matters. We can hear you. What's your question and your name?
Hello, good morning.
Good morning. What's your question?
My name is Donald from Goelo.
Yes, please.
I'm here to appreciate my medical work.
Thank you.
Thank you.
I've learned the ways to explain her issues.
Okay, thank you.
And maybe if all other midwives can borrow the same, because I don't think the way she does her things is the same way others do.
We can't hear you clearly.
Yeah, I'm here to appreciate, and I think if we can have the same treatment among all midwives, we shall be grateful.
Okay, thank you so much for that.
Welcome.
Thank you.
He literally just called to appreciate.
Oh, thank you so much.
You're doing an amazing job. So the tears.
So the tears. So what happened in the modern laboring, we don't allow mothers to sleep on their back and push a baby out. I think you've seen that. Yeah. Like you sleep on your back, your legs are folded. We call that lithotomy position.
Is that even practical?
Yes, that's what
it is.
That's what all hospitals do.
Okay.
But we've tried to educate people to run away from that. It's associated with a lot of vaginal tears. I realized that, then I was like, they are teaching us modern postures. Then I asked my mother. My mother produced 10 children, and she pushed all of them.
I think we have a caller, so maybe what I will do, I'll pick up about 3 callers, and then we answer at once.
Okay.
NTV Medical Matters. I think the caller went off, but once they come through, we shall pick most of them and then, get back.
So now I asked my mother, how did you used to posture yourself when baby was coming out? She would tell me we squat. So that is something we are trying to bring back.
Now, so that's in some research from India, and I just thought, okay, why not us?
Why not
What's happening?
Yes. So we have to totally go to midwives and train them, whichever midwife is hearing this. Allow your mothers to squat.
Yes, NTV Medical Matters.
Hello, my name is Hadija.
Yes, Hadija.
I'm pregnant and my pregnancy is 3 months old. But then I have some things that I experience that I don't even understand. I normally have water that passes out from me that is brown.
Okay.
So what brings that? I went to the hospital. They told me that since when it was 2 months, some blood came out, that maybe some things are still coming out. But you tell me what makes that?
Thank you, Hadija. We shall answer that. Anybody else on the line? NTV Medical Matters. That is Hadija. Wow. Her case is quite serious because it's just a couple of months in. It's not even like close to delivery. NTV Medical Matters, our phone lines are open. You can also go to our social media and be a part of this conversation. Also, just to remind you, we don't have a lot of time today, so we shall have another episode that will continue this particular conversation. And we shall also be talking about C-section at a later stage. So if you have any questions, make sure you note them down for the next episode. But also, if you're able to call in now, call in and the doctor will answer you. But so let's answer Hadija.
Yes.
Yeah.
So Hadija, what you're going through is not normal. However, we have changes in pregnancy that are normal. What happens with your vaginal discharge? In pregnancy, your vagina has like increased blood supply, it's warm, Then also it has a lot of discharge that is more than usual. But you know, for every woman, a normal discharge should be like yogurt, vanilla yogurt, not banana yogurt. So there's no color. It's just white, vanilla. So in this pregnancy, you could be going through, you could observe, is the discharge the same? Is the color changed? If the color is changed on the discharge, you can go to the hospital. If the discharge is increased than normal, not like spoiled milk, you can, it's a normal thing for you to have an increased vaginal discharge in pregnancy. Then if it has color change, like you've said, bleeding is never normal in pregnancy.
Bleeding is not normal. We have another caller online before we get off. NTV Medical Matters, what's your name and your question?
Thank you so much. My name is Frank.
Yes, please.
And I wanted to ask, can a woman do a normal delivery after a cesarean?
After what?
Cesarean.
After cesarean.
Ooh. All right, thank you, Sam, for that.
Yes, so for that, yes, it's normal. We have VBAC, vaginal birth after cesarean section. So first of all, before we give you that chance, you have to see again an obstetrician. They check and see what was the first cause of the first seizure. The cause of the first seizure could have been a cord around the neck, could have been a big baby. And this time I'm monitoring you and your baby is in the normal range. Normal range for babies at birth should be 2.5 to 3.5 kilograms. So there I see you have no, then I would also see, is it like a pelvic, some people have gotten pelvic fractures, so the bone can't allow a baby to come out. So some indication of the seizure in the first time can also show you that you can not push in the second time. And also the mothers out there need to learn that this is dangerous because they come insisting.
I want to
Please,
push.
doctor, I want to push.
I'm beginning to believe that sometimes it's literally, that sounds like stigma.
Stigma,
like people
yes.
around you pushing you to push, even though
yes.
you can't push.
My mother has told me, at least I should try.
Oh my goodness.
Like, you know, it's not healthy. We sit you down and educate you, it's not healthy. But such a patient sometimes could leave your place, go to another doctor.
Yeah.
Sometimes they don't, then they go to a birth attendant.
Yes.
They'll take her somewhere when she's bleeding.
So Dr. Rosen, I'm going to give you an opportunity, just like half a minute, to tell us where you're coming from and where you can be found. Otherwise, we have to repeat, to have a continuous part of this episode.
Okay. So I'm called Dr. Inembabas Rosen. I've been a doctor for over 12 years. And I'm an associate consultant obstetrician and gynecologist, working with Jaro Hospital, Chariwajara, consulting with Nurture Africa in Nasana.
Would you like to give our viewers your contact?
Yes, my number is 0773 084 184.
Thank you very much, Doctor. And most likely we shall have you again here next week. We just need our viewers to get enough information about delivery so that they can make informed decisions. Thank you very much for your insights.
Thank you.
And our dear viewers, it's really been a pleasure, but just as you know, always, we run out of time because these conversations are very deep, but we appreciate you always tuning in. And until the next episode, where actually we are coming back with the same topic, we shall leave you for now, but make sure you prepare your questions so that when we are back next week, we shall be able to pick up from where we left. I am Viola Sasira. NTV Medical Matters is supported by Bill and Melinda Gates Foundation. From the team and I, a fruitful week.